Hey, I'm Dr. Gregg with the Line Wellness Center here in Northbrook, Illinois, and today I want to talk with you about one of the specific modalities or things that we do for patients who have scoliosis. Now, if you or someone you know has a scoliosis, you may want to share this with them. This therapy and modality is particularly targeted for patients whose scoliosis is 20 degrees or greater. Now, when you have a bend in your spine that goes sideways, that's called scoliosis. And when it gets to be over 20 degrees, there's some real concerns we should have. As it gets that large and you're continuing to grow, we can wind up seeing that it progresses really fast and rapidly. Some of the principles of bone development are really getting taken advantage of for the negative in this scenario. One of the most effective tools that we've found to conservatively manage that winds up being a bracing technique. Now, there's a lot of them out there, and you've probably heard of a Boston or a Delaware brace out there. However, there are some real challenges to those. The primary one is that they don't necessarily look at the three-dimensional conformation that scoliosis winds up causing. They also wind up just looking to stop the spine from continuing to shift. Those are two big principles that wind up being a problem if you want to prevent something from progressing, let alone if you want to try and reverse it. We've found a tool called the Scoli brace. And this is an example of one right here. It's been designed for patient compliance, comfort, and utilization, as well as it's been designed to harness some of those same principles that can cause problems in a scoliotic spine. So when we wind up looking at the brace, it'll wind up looking real similar to some of the modern braces you see out there that are formed and made, including the Boston brace or the Delaware brace. However, one of the biggest components that you'll notice is difference is when you wind up looking inside. You'll notice that there is a rotation that occurs on the top from the bottom of the brace. Now, this is really important because scoliosis is a three-dimensional deformity. And if we don't wind up addressing that third dimension, there's no way we can slow it down. There's no way we can wind up reversing it. However, what we found is that when we wind up introducing that third dimension, when we wind up actually overcorrecting the spine while they're in the brace, we can wind up slowing down the progression. And in some cases, we can even wind up reversing it. So we can harness those principles that up to this point have been causing the scoliosis to progress to actually work on correcting it. Now, if you or someone you know has a scoliosis that fits this category, what I'd love to do is spend a little bit of time understanding your case, understanding what you've done, and understanding if there may be a different solution that can solve the problem, help you to wind up standing upright, and to help your body work the best that it can for you. We offer consultations that are complimentary over the phone to see if you're a candidate for care with our practice. If you'd like to find out about those, write in the comments, and we'll provide you with a link to access those. And once again, I'm Dr. Gregg with the Line Wellness Center, and I'm looking forward to letting you help us be a part of your health.